Avoid blueberries if you are taking these drugs. Understanding food-drug interactions is crucial, especially as we age. Managing our health often involves taking various medications to control chronic conditions, alleviate symptoms, and maintain overall well-being. However, it's essential to be aware that the foods we eat can interact with these medications, potentially altering their effectiveness or causing harmful side effects. This phenomenon is known as food-drug interaction. Food-drug interactions can occur in several ways. 1. Alteration of drug absorption. Certain foods can affect how a drug is absorbed in the digestive tract. 2. Enzyme inhibition or induction. Foods can inhibit or induce enzymes responsible for drug metabolism, changing the drug's concentration in the bloodstream. 3. Competitive binding. Some nutrients may compete with drugs for binding sites, affecting drug distribution in the body. Common examples of food-drug interactions include grapefruit juice with statins, dairy products with antibiotics, and leafy greens with blood thinners. Understanding these interactions is vital for seniors to ensure their medications work effectively without adverse effects. In this video, we will focus on one particular food, blueberries, and explore how they can interact with various medications commonly prescribed to seniors. 1. Blood thinners, for example warfarin. Mary, a 72-year-old retiree from Florida, loved her morning smoothies packed with blueberries. She was also on warfarin, a common blood thinner to prevent blood clots. Over time, Mary noticed increased bruising and bleeding, prompting a visit to her nutritionist. It turned out her beloved blueberries were interacting with her medication. A study published in the Journal of Clinical Pharmacology found that blueberries, rich in vitamin K, can interfere with warfarin's anticoagulant effects. Vitamin K is essential for blood clotting, and consuming large amounts can counteract the medication's purpose, leading to an increased risk of clot formation. For those on blood thinners like warfarin, it's essential to maintain a consistent intake of vitamin K. Sudden increases in foods high in this vitamin, like blueberries, can affect your medication's effectiveness. 2. Blood pressure medications, for example amlodipine. John, a 68-year-old from Toronto, enjoyed snacking on blueberries throughout the day. He was also taking amlodipine to manage his high blood pressure. John started feeling dizzy and lightheaded, symptoms he hadn't experienced before. Research in the American Journal of Hypertension indicates that blueberries can enhance the effects of blood pressure medications like amlodipine. The fruit's high antioxidant content can lower blood pressure naturally, and when combined with medication, it can cause dangerously low blood pressure. If you're on blood pressure medications, monitor your blood pressure regularly if you consume blueberries. Speak with your nutritionist to adjust your diet and your healthcare provider to adjust your medication as necessary to avoid potential health risks. 3. Diabetic medications, for example metformin. Margaret, a 65-year-old from London, loved baking blueberry muffins. She was also managing her diabetes with metformin. Despite following her prescribed diet, Margaret's blood sugar levels were unpredictably low at times. A study in the Journal of Clinical Endocrinology and Metabolism found that blueberries can enhance the blood sugar-lowering effects of medications like metformin. Blueberries have a low glycemic index, but their compounds can still impact blood glucose levels, potentially leading to hypoglycemia when taken with diabetes medications. Seniors taking diabetic medications should consume blueberries in moderation and monitor blood glucose levels closely. 4. Cholesterol-lowering drugs, for example, atorvastatin. Paul, a 70-year-old from Chicago, started incorporating blueberries into his daily diet to boost his health. However, he was also on atorvastatin to manage his cholesterol levels. Paul began experiencing muscle pain and fatigue. Research published in the British Journal of Clinical Pharmacology indicates that blueberries can inhibit the enzyme CYP3A4, which is responsible for metabolizing statins like atorvastatin. This inhibition can increase the drug's concentration in the blood, leading to side effects such as muscle pain and liver damage. If you're taking statins, be cautious with your blueberry intake. Regular checkups can help monitor your health and adjust your medication levels to avoid adverse effects. Immunosuppressants, for example cyclosporine. Eleanor, a 66-year-old from Vancouver, added blueberries to her diet for their antioxidant benefits. She was also taking cyclosporine following a kidney transplant. Eleanor started experiencing unusual symptoms, prompting her nutritionist to reassess her diet. A study in the Transplantation Proceedings Journal found that blueberries can interfere with the metabolism of immunosuppressants like cyclosporine. The fruit's compounds can alter drug levels, potentially leading to organ rejection or toxicity. Transplant patients should avoid consuming large amounts of blueberries and consult their nutritionist to ensure their medication levels remain stable. 6. Antidepressants, SSRIs, for example, fluoxetine. George, a 67-year-old from Manchester, enjoyed blueberry smoothies to lift his spirits. He was also on fluoxetine, an SSRI antidepressant. George noticed his mood swings becoming more frequent. Research in the Journal of Affective Disorders suggests that blueberries can affect the absorption and metabolism of SSRIs like fluoxetine, potentially reducing their effectiveness and exacerbating depression symptoms. Seniors taking antidepressants should monitor their mental health and dietary habits closely. 7. Thyroid medications, for example, levothyroxine. Anna, a 70-year-old from New York, loved incorporating blueberries into her breakfast. She was also on levothyroxine for hypothyroidism. Anna started experiencing symptoms of thyroid imbalance. A study in the Thyroid Journal found that high-fiber foods like blueberries can interfere with the absorption of thyroid medications like levothyroxine, reducing their effectiveness. If you're on thyroid medication, consider the timing of your blueberry consumption and take your medication on an empty stomach. 8. Pain medications, for example, ibuprofen. David, a 69-year-old from Los Angeles, used blueberries to manage inflammation naturally. He was also taking ibuprofen for chronic pain. David began experiencing gastrointestinal issues more frequently. Research in gastroenterology indicates that blueberries, due to their high antioxidant content, can exacerbate the gastrointestinal side effects of NSAIDs like ibuprofen, leading to an increased risk of ulcers and bleeding. Seniors taking pain medications should be cautious with blueberry intake and consume them in moderation. 9. Antihistamines, for example, cetirizine. Susan, a 65-year-old from Seattle, ate blueberries daily to boost her immune system. She was also taking cetirizine for her seasonal allergies. Susan noticed her allergy symptoms were not improving. A study in clinical pharmacology and therapeutics found that blueberries can affect the metabolism of antihistamines like cetirizine, potentially reducing their effectiveness. If you're on antihistamines, monitor your symptoms and discuss your diet with a healthcare provider to ensure your medication remains effective. And antacids, for example, omeprazole. Henry, a 72-year-old from Edinburgh, enjoyed blueberries as a healthy snack. He was also taking omeprazole for acid reflux. Henry noticed his reflux symptoms were not well controlled. Research in alimentary pharmacology and therapeutics suggests that blueberries can affect the absorption of proton pump inhibitors like omeprazole, potentially reducing their effectiveness in managing acid reflux. Seniors taking antacids should be mindful of their blueberry intake to avoid interactions with their medications. Now I'm going to show you the best tips on how to safely consume blueberries to improve your health. Without this information, watching the video up to this point wouldn't make sense, so pay close attention to gain the benefits of blueberries while avoiding potential health risks. Follow these guidelines. 1. Timing matters. Take your medications at a different time from when you eat blueberries. For example, if you take your medication in the morning, enjoy blueberries as an afternoon snack to minimize the risk of interaction. 2. Consistent intake. Maintain a consistent intake of vitamin K if you're on blood thinners. Sudden changes in vitamin K consumption can affect the effectiveness of medications like warfarin. 3. Regular checkups. Have regular checkups to monitor your health and medication levels. These appointments can help catch any potential issues early and allow for timely adjustments to your diet or medication. 4. Stay hydrated. Drink plenty of water to help your body process the antioxidants and fiber in blueberries. Staying hydrated supports overall health and can help mitigate any adverse effects. 5. Be aware of symptoms. Pay attention to any changes in your health when introducing blueberries into your diet. If you notice unusual symptoms, it could be an indication of a food-drug interaction. 6. Adjust medication dosage. Work with your healthcare provider to adjust your medication dosage if necessary. This is particularly important if you experience changes in how your body responds to the medication. 7. Choose fresh blueberries. Opt for fresh blueberries over supplements or processed products. Fresh berries provide the natural nutrients without added sugars or preservatives, which can affect your health. 8. Balanced diet. Ensure your diet includes a variety of fruits and vegetables to avoid overconsumption of any single food. A balanced diet supports overall health and reduces the risk of adverse interactions with medications. 9. Avoid processed blueberry products. Processed blueberry products, such as jams, jellies, and syrups, often contain added sugars and preservatives that can diminish their health benefits and potentially interact with medications. Stick to fresh, frozen, or dried blueberries without added sugars or chemicals. 10. Wash thoroughly. Always wash fresh blueberries thoroughly under running water to remove any pesticides or contaminants. This step is especially important for seniors, as their immune systems may be more susceptible to food-borne illnesses. 11. Start with small amounts. If you are introducing blueberries into your diet for the first time, start with small amounts to see how your body reacts, especially if you are on medication. This gradual approach can help you identify any potential adverse effects early on. 12. Check for allergies. Although rare, some people may have allergies to blueberries. Symptoms can include itching, swelling, or difficulty breathing. If you experience any of these symptoms after consuming blueberries, seek medical attention immediately. 13. Track your diet. Keep a food diary to track your blueberry consumption and any changes in your health or medication effectiveness. This can help you and your nutritionist identify patterns and make necessary dietary adjustments to ensure your overall health and well-being. 14. Consult your nutritionist. Discuss your diet with a nutritionist, especially if you're taking medications. They can provide personalized advice tailored to your specific health needs and medication regimen. Blueberries, with their numerous health benefits, are a delightful addition to any diet. However, for seniors over 60, it is crucial to be aware of the potential interaction between blueberries and various medications. These interactions can alter the effectiveness of your medications or lead to harmful side effects. By understanding the specific interactions with blood thinners, blood pressure medications, diabetic medications, cholesterol-lowering drugs, immunosuppressants, antidepressants, thyroid medications, pain medications, antihistamines, and antacids, you can make informed decisions about your diet. It's important to remember that while blueberries can be beneficial, they must be consumed thoughtfully, particularly when you are on medication. Regular consultations with a nutritionist can help you balance your diet and medication effectively. This proactive approach ensures that you can continue to enjoy the nutritional benefits of blueberries without compromising your health. Always monitor your health and any symptoms closely, and don't hesitate to seek professional advice when needed. Thanks for watching.